I would like to propose. First, let's try to create a safe space for the session to ensure everyone can equally participate in safe environment. We would like all participants and the interpreters to keep sensitive information shared in the session confidential. If there's anything that you would like to share with colleagues relate back to your work, please try not to attribute specific content to any individual to ensure confidentiality. In addition, we would like to also this session to be guided by the principle of non-discrimination and safety, and encourage kindness and respect to each other as we proceed with the discussion. During the presentations of our speakers, you might like to log your questions in the chat box. I will pick up these questions throughout the presentations to ask them, or you could raise your hand later after the sessions. Once we have the discussion, you probably already know there's a panel with reactions in this Zoom application. You can just raise your hand or thumbs up, and that will symbolize that you'd like to speak, and I will turn to you, give you the floor. Without further ado, I would like to introduce our special guests today, Marlene and Rabia. We'll begin from introducing Marlene, so I will just give her background before we get to her presentation. So first, Marlene Leisenheimer. She worked on the migration and integration research at the Political Institute at the University of Friedrich Alexander Universität Erlangen, Nuremberg, and she co-authored a study called The Effects and Scenarios of COVID-19 on Migration and Integration, published last April. She also wrote her bachelor's thesis on the integration of migrant women and girls during COVID-19, which will be published on the website soon. She studied theater and media studies and political science at the Friedrich Alexander Universität Erlangen, Nuremberg. Welcome, Marlene, and the floor is yours. Thank you for being with us.
Thank you, Sandra, for the introduction. I'm Marlene Leisenheimer, and I'm happy to be here today. As Sandra just said, I will present the results of a study that I co-authored last year. The COVID-19 pandemic has its effects on all aspects of society, economy, and politics, and people with migration experience and refugees are hit especially hard. Our study, supported by the Stiftung Mercator, examined these effects in the participation areas: health, housing, education, work, as well as the cross-section topic, discrimination and racism. Maybe now would be a good time to share the presentation, Lucas. Thank you. I can't see it yet, so I will wait a second. Perfect. We conducted a desk-based study, hence we didn't collect our own data, but instead our research relied mostly on secondary data. Our aim was to find out challenges and problems, as well as ways to address them. The project was on for 6 months and was conducted by PhD student Yasemin Bekyol, Professor Petra Bendel, and me. Looking at current developments, we then also deducted policy recommendations for each field. I would like to present the main results of our study to you now. Let's go to the next, thank you. Let's start with some general observation on mobility and migration. Border closures that became reality in most countries of the world led to insecurities and to precarious living conditions, especially for stranded migrants and refugees. They suffered from a lack of information, a lack of healthcare, and a higher stigmatization. But those mobility restrictions have affected different groups in different ways. For quite a long time, for example, asylum seekers have not had access to asylum. Resettlement programs, humanitarian admission programs, and family reunifications had been paused, and some are still restricted now. At the same time, restrictions, especially for seasonal migrant workers, have been avoided or lifted quickly. Now to participation. If you could go to the next, thank you. Let's start with the access to health. Existing barriers related to migration, such as little German knowledge or a lack of information about care concepts and structures, have become bigger. They have especially hit vulnerable groups, such as disabled people or people with chronic diseases, as well as women. Already before the pandemic, the access to health for migrants has been criticized in Germany, especially as asylum seekers here only have access to emergency aid, emergency care in the first 18 months of their stay. And this doesn't include, for example, mental health services. Therefore, our policy recommendations are that these barriers need to be addressed and can be lowered, for example, by expanding multilingual accessibility. It has also shown that we need a better access to psychological and psychiatrist health services generally, but especially related to the current crisis. A lot of asylum seekers have experienced different forms of violence and are often traumatized. Lastly, the access to masks and vaccinations also going forward should be made easier and more accessible for refugees and migrants. Let's go to the next topic, which is housing. The lockdowns have proved that collective accommodation for refugees as well as for migrant workers is especially inappropriate to minimize infections. There is a lack of toiletries like soap or other toiletries, as well as a lack of information. Social distancing is also not possible in most cases. Additionally, the isolation of such accommodations took away most possibilities of consultation, such as therapy or similar services. As the topic of this event is mental health, I also want to stress that the isolation during the lockdowns has led to feelings of loneliness, especially amongst the migrant community. There have also been positive measures, sorry, that was too quick, thank you. Also been positive measures to protect the residents of such accommodation that almost seemed impossible before. For example, people have been allowed to move out of rooms so that they are not full anymore. There have been new canteens and common rooms, and in some cases, they created resident councils to allow an easier communication. This brings us to the policy recommendations. Wherever possible, housing and collective accommodation should be avoided or minimized. There should be a more transparent complaint management system, and anti-discrimination measures can help in supporting migrants and refugees in their access to the housing market. Now the next, thank you. Our next field is education. Existing inequalities in the education system that have existed before the pandemic have been exacerbated and made more obvious. For a lot of migrants and their children, homeschooling has been hard, as they often didn't have access to Wi-Fi or to laptops, tablets, etc. In addition, volunteers couldn't see migrants in person for quite a long time. Those problems, again, were especially hard for those that live in the collective accommodations. Lastly, also, a lot of parents couldn't help their children in school due to a lack of language skills or different education backgrounds. Therefore, to avoid lasting damages for groups that are already disadvantaged in education, the access to digitalization should be made easier and the commitment of volunteers should be encouraged. Digitalization doesn't only mean financial aid for schools, but also education in that field, as well as the commitment of schools and teachers. And going forward in this, we also need to consider diversity. The next area is work, where the effects of the pandemic have been especially hard. Little language skills, different education levels, as well as the difficult recognition of qualifications have been barriers for a lot of migrants before the pandemic. But still in the beginning of 2020, a lot more asylum seekers had a job in Germany than was expected. But the pandemic hit employees with migration background especially hard, as they have predominantly worked in very endangered jobs with uncertain terms of employment or in jobs that were not suitable for working from home. At the same time, the pandemic has shown that a lot of migrants and refugees are so-called key workers. In Germany, this has also led to some positive measures, such as the extension of contracts and an easier recognition of qualifications, especially in the health sector. On the labour market, therefore, the state needs to make sure that support measures create safer and more equal working conditions. Additionally, the recognition of qualifications as well as post-qualification measures needs to be made easier, and integration measures in this field need to be reconsidered. Last but not least, discrimination and racism. During the pandemic, and especially on social media, discriminating and partly racist discussions directed towards refugees and migrants have increased. Migrants and their children were victims of scapegoating, of hatred, violence, and other forms of exclusion. A report of the German Center for Anti-Discrimination has, for example, shown that in Germany in 2020, the requests for consultation about discrimination on racist grounds have increased by almost 80% compared to 2019. Therefore, as our study has shown, we need proactive action against racism and scapegoating, especially on a national level. Apart from reactive work, we also need preventive, anti-racist education, not only at schools and universities, but also at the workplace, like in companies and in housing and health facilities. That's where I'm going to sum up our main results on the next slide. Thanks. We might lose a lot of our integration successes of the last years if we don't react appropriately. We need a commitment on all political levels and in all areas of responsibility, as well as in society. The pandemic has shown that migrants and refugees are not a homogenic group, but individuals with own needs. That's why we need inclusive, communicative, and comprehensive measures. Generally speaking, multilingualism is very important, as well as debates about naturalization or communal suffrage for third country nationals. The pandemic has shown an urgent need for a sensitivity towards diversity, not only in institutions that deal with migration and integration, but also in health facilities or other authorities. That's where I stop my presentation for now. Thank you for listening. I'm looking forward to our discussion.
Thank you very much, Marlene. It has been an excellent presentation, and you have touched upon so many different dimensions, showing the complexity of the effects of COVID-19 on the refugees, and how the situations have been exacerbated on so many different levels. And yet you showed us some way forward recommendations, what needs to happen to improve the situation. Thank you so much, and we will follow up with the discussion. Now, let's hear what's happening in Turkey. So we already know what's happening in Germany. And now our dear speaker, Rabia Olcak, will present. Let me just introduce Rabia. She's a clinical psychologist. She has been working at the Turkish Red Crescent Community Center for the last 4 years in Kahramanmaraş, if I read it correctly. She conducted research on COVID-19 and refugees, focusing first on the understanding of the enablers and barriers in health service access among COVID-19 infected refugees in Turkey, which she presented at London Migration Conference. And second, she focused on understanding the pandemic experiences of refugees in terms of their psychosocial well-being. The title is Perspectives of Refugees Residing in Turkey. She will present today these research results in our session today. She studied clinical psychology at the International University of Sarajevo in Bosnia. Her master thesis topic is about the personality and social variables as factors of depression. Now she's pursuing PhD in clinical psychology at Hasan Koloyoncu University in Turkey. Welcome, Rabia. We are happy to have you. The floor is yours.
Hi, Sandra. I am thanking you for introducing me. And Marlene, it was a great presentation. Congratulations. And can you make it? What? Yeah, as you can see that my topic is going to be large place, but I will do my best. I will briefly explain our findings and what is our result are. So the first one is understanding the enablers and barriers in health service access among COVID-19 infected refugees in Turkey, which is presented London Migration Conference. And second one is understanding the pandemic experience refugees in terms of their psychosocial well-being perspective of refugees residing in Turkey. Actually, we conducted with the research which divided into two different subjects in one research. So next, please. So it is our content part. First of all, I will start the aim of the study and then continue with the introduction part. And we are really care about the observation from the field. We have method parts, findings, and conclusion. Next, please. The aim of the study is to provide the insight on the experience of COVID-19 infected refugees in accessing health service and understanding the pandemic experience of refugees in terms of their psychosocial well-being. So we have 6 areas that we are willing to discover. The first one is a language barrier. We want to know how refugees are affected from the language barrier. So the second and third one is a difficulty to reach health service and difficulty to follow-up procedures. We want to make brighten of obstacle of these areas as well. And also there are economical consequences of pandemic. We are willing to know how this issue affects the refugees, and others are limited social interaction due to the pandemic. And according to observation, there is an increased level of anxiety. So we want to discover this area and get the answer for our research. So next, please. Introduction. In Turkey, a total 4 million migrants are living, and COVID-19 pandemic has been resulting unprecedented economic and social consequences across the world, where measures prevent to prevent the disease and health service provision fell short in many countries during the pandemic. Migrants become among the most vulnerable group as they pre-existing adverse living conditions such as crowded households, poor living conditions, limited access to service, and economic hardship. So access to health, actual use of personal health service, and everything that facilitate or impedes their use. Access means not only getting the right service, but also getting the right service at the right time to promote improved health outcomes. COVID-19 pandemic, in addition to registration issue, language barrier, and low health literacy. Now we can go on. And as you can see the circle that I will briefly inform you about the Turkey health service procedure and what is mobility of migrants means, and language barrier reach the health service, economic and social consequences of pandemic. So I will briefly inform you about the procedure of Turkey. Migrants living in Turkey are able to get primary and secondary health service. In addition to primary and secondary health service care service, migrants' health service centers and family doctors offer internal medicine, child doctors, gynecology, oral and dental health, and psychosocial support service. Nevertheless, migrants living in Turkey encounter certain restrictions and barriers in accessing health service. Firstly, application of registration and completed registration process is the major challenge for the migrants. According to rules of Turkey, the health service to be given the Syrian, those who have not completed registration can only benefit from contagious and epidemic prevention service and emergency. What about mobility of migrants is another obstacle to sustaining access to health service. According to the regulation, it is essential that those under temporary protection receive health service in the province they have been registered. So Syrians who are under temporary protection frequently change their place in order to find work. Meanwhile, they lost their access to health service. And more important physical obstacle to increase accessible of vulnerable group is low health literacy as well. If ones move their city for finding a job or something else, they can get service from the private hospital. But if you if he or she wants to take a secondary health service, they can only benefit from this city to private hospital unless they do not have dispatch documents. So they need to move their city that he or she has been registered. This is the huge obstacle because generally they do not have enough money to pay a private hospital cost. So also, the most prominent difficulty is the language barrier. They have a difficulty in describing their physical or mental problem or understanding treatment that doctor prescribed. It is really difficult to explain themselves to doctors. Actually, we have some interpreters in each hospital in Turkey, but I think the number of interpreters is less than it is needs. That's why it's kind of difficult. Make difficult situation for refugees. So I already mentioned about economic and social consequences previous slides. Next, please. So we are really care about the observation floor of the fleet, which makes our research stronger. A survey consists of open-end question, 10 qualitative questions, observation of 15 specialists, psychiatry, special clinical psychologists, psychiatric nurse and clinical development specialists, child development specialists. So they also found that language is the huge barrier for reaching health service or describing their moods or symptoms. And they also reported that increase in anxiety, reluctance, sleep disruption, and anger. And the specialists found also there is a conflict between the family members, and family relationship is going to be a hard time during the pandemic. Next. So this is our method part. As I mentioned, that it is the qualitative research that semi-structured interviews were carried out with 17 participants. Data were coded using thematic analysis approach through the CATMA. And interviews are carried out by psychologists who have master's degree in clinical psychology through a video communication application with assistance of professional interpreter. So next, please. As you all can see that these are the table of our method parts. We have 17 participants, 8 male and 9 females, and you can see the age interval, and there is the occupation and the number of children. And we stated mostly mention physical symptoms, which are aches, fever, fatigue, loss of taste of smell, and difficulty in breathing. Nationality was 2 Turkmens and 15 Syrian. Next, please. These are the result of enables and barriers in health service access. You can follow up from the tables that we have 2 teams, which is enables and barriers. We have several sub-teams as well. I will start with enables. Good level of knowledge about disease and related symptoms, and having pre-existing chronic disease prompted participants to apply the hospitals. So most participants highlighted that they have no difficulty accessing health service, including having tests, medication, and inpatient care. They also reported that female practitioners made calls to check their health status after diagnosis. Moreover, participants with high awareness of transmission took precautionary measures before applying to hospital, including wearing masks, applying hygiene practice, and self-quarantine. So, fever, we have barriers. I already mentioned about being registered in another huge obstacle for reaching health service access. So the another one is the language barrier, and language was not another barrier for some participants, as it was barrier for some participants, and it is caused communication problems with health workers and made it difficult for them to express the related symptoms. And lastly, the subteams is limited knowledge about service utilization prevents some participants to apply hospital. So next, please. So we have result of psychosocial effect of pandemic. We have three teams and several sub-teams. The first one, psychological impacts, which is this emotional effect and cognitive behavioral effect. The second one, the relational impacts, the family relations with Turkish community and restricted relation interaction. And coping strategies are social support using religion as a coping strategy and active coping strategies. So in discussion part, I can deeply explain these sub-teams as well. So next part, please. Conclusion, I will briefly conclude our research. Understanding of refugees' experience is essential in establishing their needs and increasing health service access. These findings suggest that the refugees population needs to be informed about COVID-19 transmission and service usage, and language support should be provided by having interpreters presented at hospital to increase the health service access. And the second one is the understanding the refugees' experience about psychosocial well-being is needed to expand to psychological support on refugees by mental health workers, and became a mediator to improve the tie between nations. And this the research helped us to recognize which coping strategies are mostly using by refugees. So next slide. Thank you for all. Teşekkür ederim and thank you.
Thank you very much, Rabia. You have shared findings of a very important study. I'm really glad that you brought it forward, because it's quite a unique study too, because you looked at those who have been affected by COVID, those who contracted COVID. So well done for that. And thanks for, in limited time, highlighting all the key issues. We learned a lot. Thanks for highlighting, especially, we will give you more time to talk about the psychosocial effects soon. And giving us the background to the specific physical and other barriers affecting people's access to health services. Thank you again. And I will open now the floor for everyone to ask questions to our speakers. Are there any participants who would like to ask questions? Please feel free to. Oh, we have some question in Turkish. May I request a translator perhaps to translate it for us as well in English? Meantime, Rabia, maybe you can also look at that. And if you like to raise your question by speaking, please raise your hand as reaction on your screen. I'm just screening, no one is raising hand. So let's begin from the Turkish question. Marhaba, yeah.
Is there an interpreter?
I can translate it. Yes, let me check. So, yeah, yes. No, there is an interpreter. Can you hear me? There is an.
Yeah, we hear you.
Okay. Yeah, I do see it. Do you hear me? I'm the interpreter. Do you hear me?
Okay, we will wait for the interpreter to
Okay, can you hear me? Can you please go to the English channel?
I was wondering, well, we would still request an interpreter to translate the question that is in the chat box to English. In English.
Sandra, sorry.
Yes, thank you. I can hear you now. Yes.
Okay, perfect.
Okay, so my question goes to Rabia. Well, could you please explain the psychosocial impact in the results section, the impact of sentimental, cognitive, and behaviors, the impact of all of these? This question goes to Rabia.
Wonderful. Thank you very much. Yeah. Rabia? Yeah.
I heard it. Thank you very much. So I will explain this question then. First of all, the emotional effect of the pandemic appears in two ways in our result, positive and negative emotional effects. There were participants who stated that it was good for them to be freed from their responsibilities for a while, when they felt that their values were understood and loved during the illnesses process. However, Turkish Red Crescent employees state that difficulties in family relations and intra-family conflicts increased with the pandemic process. They also reported that, I will briefly mention about it. It's about the coping strategies. Then, in addition to emotional effect, that negative mood status such as depressive symptoms, increased anxiety, irritability, and sleep problems were reported more frequently. And migrants in the study state that they felt isolated, extremely stressed and angry before the pandemic, but they say that their anxiety levels increased with the pandemic. And transmission of the virus to others, care and education of children, and economic difficulties are among the reasons for the increased anxiety. Although they said that employees are often described as understanding because they allow them during the illnesses, but the reduction of salaries of participants for the days they work in quarantine made it even more difficult for migrants' family who were already struggling economically. So cognitive, these are the all emotional effects, but the economic and the studies are really has huge impact on the emotional effect. So cognitive and behavioral effect in some migrants, delayed response, amnesia, and they state like decreased self-care. Also, if we look at the observation from the field, experts report that they observe an increased case of anxiety, reluctance, introversion, sleep disruption, anger, and domestic violence, especially during the pandemic process. So they stated that anxiety symptoms were associated with increased dismissal and difficulty in finding new job during this period. So these are all our emotional and cognitive behavioral effects. Is that okay?
Yes, that's very extensive. Thank you very much for explaining on that. If anybody has any follow-up question based on this, please feel free to ask a follow-up question. And we have hands up from Jalal. Jalal, do you want to ask a question?
Really, I have a comment that COVID-19, yes, created some problems, some psychosocial problems and effects. But there is a very important thing that it uncovers. It uncovered some things that were before COVID. I think, I know, I want to introduce myself. I'm a psychiatrist working in Gaziantep with the Syrian refugees. So there were some problems that we know about what COVID uncovered and what COVID created. The first one is the people really had bad relations because the men working more than 12 hours or sometimes 14 hours, then they don't know anything about their children, about their wives, what they are doing. And when they come back, because they are tired, they work on mobiles, then they have a bad interaction with their wives and families. So when they became 24 hours or maybe 20 hours with their families, they dealt with the people who don't know. So that makes a kind of anger, a kind of domestic violence, because we know that violence is created by not knowing the things. If we ignore something, we sometimes be violent. So they became violent to where their children, their wives, their demands, and when they feel, when we are talking about anxiety, what kind of anxiety? Anxiety because they haven't work and they haven't money to have bread for their families. These things really important to know. It is not created by COVID. It is only uncovered the problems of the relations between the parents and the families, between the couples, the wife and the husband. That was really widespread and with a kind of domestic violence.
Thank you very much, Jalal, for your intervention. Yes, this is a very important point to remember. There's a range of pre-existing issues, and the pandemic has just exposed these issues, yes, and thanks for helping us to understand where this domestic violence, interpersonal violence might be deriving from. And I don't know if any of our presenters would like to add anything on the issue of family dynamics and interpersonal violence. If there is anything that you'd like to add to what Jalal has said. Or anything in relation to family and gender-based violence. Or, okay, if not, we can move forward. So we might have other questions. Yeah. Okay.
I can add something on relation. Mm-hmm. I am agree with what Jalal said. I already mentioned about the migrants in study. They already mentioned that they felt isolated, extremely stressed, and angry before the pandemic. So these are the participants saying, which is totally right. So, but I can add something else about the relationship because there is huge effect of pandemic has emerged in the context of relationships. In our research, many participants reported that family ties were strengthened in this process, and family members had the opportunity to spend more time with each other and got to know each other better. So, in the context of relations with Turkish society, they mention about that, which is another sub-theme. The participant who stated that they often had limited communication before the pandemic. So they say that they were more excluded during the pandemic process. And within the scope of the limited social interaction, sub-theme, the inability to visit relatives, which is considered very important in Syrian culture. And together with the pandemic and the inability to go Syrian during the holidays create a complaining situation for many participants. As we observe that participants are complaining about not to communicate with their own nation. It is they already all, I think participants mentioned about they were all limited communication with Turkish community. And it was also a great chance to me to examine these interviews for this research, because I was also doing this interview, and the participants say that we are not complaining about the Turkish community. We just get used to that relationship. Actually, there is a huge gap in that relations. They commonly state, how can we communicate? There is a language barrier. But some of Syrian participants also mention about, okay, I don't speak Turkish, but I can use my body language. So some of them find a way to communicate the Turkish community, but some of them not. But the thing is, they are not criticize the Turkish community, because all of them maybe have this conscious that I am a migrant to their country and they can have some attitudes towards me. I can understand that, and I can have I can occur boundaries from them. So actually they have this consciousness, and they are not complaining at all about the relationship. But of course it happens huge negative impact on the relations between the nations. This is all I can say.
Well, thank you, Rabia. Yeah, Marlene, you like?
Yeah, I think I can also add something. I'm just like, something I want to say is how interesting I'm finding it that even though we have very different perspective on the topic and did research in different countries, it seems to be very similar outcomes. But I'm also finding it very interesting to hear your perspective on all this. I just want to add a few things. As we have heard now, sexual and gender-based violence has been on the rise since the start of the pandemic, and this is worldwide. And the reasons might be increasing socioeconomic tension, isolation, frustration, but also less possibility for victims to seek help. In Germany, for example, battered women's shelters, so places where women can go to get help, victims of sexual and gender-based violence can go to get help, they were occupied without the possibility to let anyone in many cases. Also, during the lockdowns, they couldn't let anyone in because of the contact restrictions. And then they also had less space to take people in due to the restricted number of people that were allowed in one room, and so on and so on. And they also only had access to tests rather late in the pandemic. So this was also a problem, that less women got to seek help. And additionally, even if they didn't go to seek help in those shelters, but in friends or volunteers or some kind of social contact person, they also couldn't do that for a really long time. So I think that was also a very big factor to all of this, that there was just less possibility to seek help. And that means that going forward, we need to ensure that there are those structures, those helping structures in times of a crisis as well.
Yeah, thank you, Marlene, for turning us to the future and directing us to think about what needs to perhaps happen for us to help compensate for the conditions that have been created for the nations to be able to rebuild, recover with inclusive approach towards refugees. Yes, making sure that refugees are part of this recovery efforts across countries. And thanks also going back to Rabia and yourselves and your comments about relational issues and yes, gender-based violence, but also relations between nations. I think this is a very important point. And we all noted, yes, in our own lives, we had to restrict our social contact, and we can only, we need to be reminded that this social contact that for us might be, we might take it for granted, for many people with restricted legal status or illegal status or temporary status, who are counting on social relations, social contacts in the communities as means for survival, because that's perhaps for many people the only way to gain support from neighbors or from community centers. It has been life changer during the pandemic, where all these bonds have been cut and suddenly people couldn't turn to each other. And naturally, it has an effect on integration and relations between nations. Yes, mixing of settled and migrant communities. I know you have also covered, Merlin, in your study a little bit about discrimination and increased racism. I don't know if there's anything that we should pick up on that. And I know we have only 30 minutes left, around 10 minutes left. Maybe we could also turn to discuss what needs to happen. And I invite all participants to think as well, looking at your programs and your sphere of influence, like and broadly, nationally and locally, what do we need to do to help recover and mitigate the negative effects that have been created by the pandemic? What are there any suggestions for, what will be the priority? Is it, or how many priorities can we have at the same time? Is it health, education? I don't know if there are any comments, any suggestions from the audience too on that. So I just opened that discussion. Anybody like to come forward to respond to it? Okay.
If not, I can start as well.
Yes,
I mean, I have already shared our policy recommendations generally, but I think it's also important to bear in mind that all these areas that I talked about are interconnected. So helping migrants in their access to work, it will improve different things like mental health, possibly will maybe be a part in fighting racism and so on, or education is very important for all the other fields as well. But I think very importantly, we need proactive action against racism, discrimination in all fields, because that is something that happens in every, we have that on the workplace, we have that in education, we have that in health, and also in housing, in the access to the housing market. And so we need to try and find ways to combat racism and discrimination in those fields. And that can, for example, happen by expanding multilingualism or by considering diversity in policy measures with, for example, inclusive, communicative and comprehensive measures. And I think as the topic of this event today, or of the topic of the event, is mental health, that we need to stress again that mental health and also physical health services need to be, migrants need to have access to mental health, and they need to be able to go through these processes if they need to.
Yes, thank you very much for pointing to those interrelatedness issue. Yes, all domains are so much interconnected, and progress in one area often has effect on others, and it's very important for integration, but also well-being and improving, protecting people's mental health to ensure progress in different domains. And there are sometimes unexpected ways for people to get better. Like in one area, progress can have a massive effect on improvement of entire family's lives. That's sometimes improvement of one person in the family can have an effect on the entire family too. I don't know if there are any other comments regarding future and way forward. Anybody from participants, or any other comments or questions and questions to our speakers? Is there anything that has come to mind, or is there anything that you can relate to our speakers in your experience? We would be very interested to know who is with us. We have limited time to get to know who is with us in detail, but if there's anybody volunteering, that would be great. I feel the need, I know that's interpreter who has unmuted himself there. Okay. Please feel free to put that in the chat box or raise your hand and I will continue the discussion. I was always, I meant to ask you, I was wondering also whether we have noted any differences in Germany and Turkey of COVID-19 effects on women and girls and then men and boys. Yeah, this is an interest of my study as well that I've done in other countries, well, including Turkey, but I've done my study in also Sweden, UK, Australia, and Tunisia. We had this gender lens looking at the differences that we tried. I don't know if there's anything that you have, Rabia and Marilyn, to share about differentiated impact of COVID on women and men.
I'll start, if that's okay, Rabia. Yeah, I wrote my bachelor's thesis about the topic of the effects of COVID-19 on the integration of migrant women and girls. And so I'm trying to sum up a bit the results, but it is actually, it's a lot, and it's a lot more than you maybe think, but it's different factors that exacerbates inequalities also, inequalities in terms of gender. And migrant women are hit especially hard. This is due to intersectional forms of discrimination that meet each other and kind of create new inequalities in a way. There are different factors to this. For once, women who already had a much higher share of unpaid care work than men have taken on even higher care burdens during the pandemic. Due to school closures, for example, they were the ones often to take care of the children that were at home now. And this again affects, for example, their possibility to participate in language courses, but also puts them under more pressure and stress, which then affects the mental health as well as the physical health. Also, in a lot of cases, men are the main earner, and especially migrant women are less likely to be working in Germany. And then again, if they work, they are most likely to work in care jobs or in the health sector, where a risk of infection is very high. We also have the issues of caregivers in private households. In Germany, there are about 500,000 migrant women, especially from Eastern Europe, that work in private households, often taking care of older people. In the pandemic and due to the lockdowns and contact restrictions, a lot of these women were either not able to come to Germany or they were locked into a household and had to risk infection while often being underpaid and also exploited, unfortunately. And last but not least, as we've already mentioned, the sexual and gender-based violence has been on the rise. But due to all these factors, the mental health of migrant women is affected adversely, and discrimination, racism, sexism, insecurity about the legal situation, isolation, socioeconomic factors, and all that have definitely had their impact on migrant women.
Thank you, Marilyn. That's really helpful. Thanks for highlighting those issues of how gender roles have been a factor influencing women's workload. And yes, that's really important to understand. And in understanding mental health conditions of women and men, yes, it's important to look at the gender roles and how pandemic has affected their workloads. Thanks for highlighting other issues as well. We have a question here in the chat box. We would like to request a translator to translate for us. We are switched to English. We can probably hear you if you speak. Yeah.
Hello, I'm going to translate the question in the chat box now. Hello, first of all, thank you very much for all the invaluable information you shared with us. I have a question for Rabia Hanım. How have your beneficiaries used their faith as a coping strategy? How have they used their faith as a coping strategy? This is the question.
Great question, Rabia.
Yeah, the answer takes lots of place, but we have limited time. I will briefly inform you about what participants mentioned about. And for many participants, belief appears to be functional in coping. It seems that praying, giving thanks and surrender and belief in destiny help the participant to cope with problems brought about by the disease process. And as we all know that their background has been full of negative life story because of the migration, but they use religion as a very functional and strong coping strategies. And during the interview, I realized one thing. When they are talking about horrible or terrible memories for themselves or the experience during the pandemic, their facial expression, like they have the submission which reflects their facial expression. So they taught me that how religion and faith and belief are essential factor to cope with such terrible events or situation. Mm-hmm. They use mostly faith and belief as a coping strategy.
Thank you, Rabia. It turns out this is a subject of my PhD, looking at the role of faith in coping. So would you like to tell us a little bit more about what resources particularly help them to cope, of what religious resources they use? Are there?
Sorry.
Yes.
Can you repeat it? Sorry.
Yeah, I'm asking what religious resources help people to cope. Are we talking about what are the most frequently mentioned things? Is it prayer? Is it reading the Quran? Or is it fasting? Or is it a combination of everything? Do you know any further detail?
Yeah, it is kind of the combination of everything. They also mention about repeated the praying, reading Qurans makes me relief, and I have this kind of feeling that it is destiny. I cannot change it, and I do not have control on it. So this is what's happened. I need to go on that way. I need to live in this situation because God gives give it to me. So I am. They say that I am welcome. This is because I do not have any control on this. So they are praying in 5 times, even they have a difficult situation for their physical symptoms are really high. So they have aches, they have a difficulty in breathing. But despite of this, they are praying during the illnesses in 5 times a day. And they said that when I read Quran, I relieve so much.
Thank you, Rabia. We'll be wrapping it up. Thanks for highlighting the issue of meaning making. The religion often helps people to find meaning. There are lots of positives, but sometimes it can also have some negative effect too. People may often believe it can be a form of a punishment, like the disease and other things. So it's a subject of further discussion. It would be lovely to exchange with you further outside of this session. So I would like to thank again Marlene and Rabia for your excellent contribution to this session and sharing the effect of COVID-19 on refugees in Turkey and Germany. I thank all participants for your participation and your patience. And we look forward to meeting you in the plenary in 30 minutes. This session will be closed right now. Thanks again. If there are any follow-up questions, I don't know if Marlene and Rabia would like to leave their contact details in the chat box, just in case if anybody would like to follow up with them, you probably are free to do so. And thanks again for being with us this morning on Saturday morning. Yeah. And I look forward to seeing you in the plenary. We will report back the main discussion points. Thanks again. Bye.
Thank you. Bye.
Thank you. Bye.